All right, guys, here we go. We're embarking on our online portion of the class. And in this lecture, we're going to be talking about health insurance and kind of the basic things that are parts of health insurance that make it work. The underlying thing to understand is that insurance is all about risk. So insurance companies, with the exception of maybe Blue Cross Blue Shield, are for-profit companies. They use actuarial science so that they can predict their risk, therefore insure you. So you would be passing on your risk to the insurance company who has an idea of just how risky you are. So let's take a look at this. So here's our basic learning objectives. And so as we know that the healthcare financing system is very complex, but there are some basics about insurance that we will explore here. So as I said, healthcare is a very complex system. People are complicated, and some people are riskier than others. So as we looked at back way at the beginning, we saw that the financing mechanism of which insurance is a part is one of the underlying features of the healthcare system. And it's intertwined because as technology, and remember our technological imperative that we talked about, we like our technology. We want those CAT scans. We want those MRI scans. Everybody wishes that they could go have a test to see if they are positive for COVID right now. I actually was exposed to someone who was exposed to someone who has tested positive, but I have no symptoms. And so they are not going to pay for me to be worked up for COVID. And so I have to just hope that that I am not positive, and I have to be very careful about who I interact with. So you should be glad you're not in class with me, because I don't know. I don't know if I'm shedding virus. And so anyway, the point is that we have all these technological advances, but the healthcare insurance industry is very careful about deciding which things they will cover or not. And so in part, what the insurance company doesn't say to a physician, no, you can't order this test. They don't say to a patient, no, you can't have this test. But what they do say is we're not paying for it. So we've seen how expensive so much of healthcare is. And so with that regard, are you willing to pay for it yourself? All right, so one of the things we said about our system is we are a multi-payer system. That is one of the things that increases our cost because countries that are in single-payer systems are able to manage the COVID crisis a little bit better. I'm not saying they're doing a better job. I'm just saying they can manage it a little bit because they can direct things from a central source of the government and say everything is covered, everything is not. In this country, we find Congress is trying to pass legislation that will mandate that everybody can be covered for COVID testing without any, what we'll understand later, co-payments or deductibles. But there is debate as if you are sick, they backed off of, at one point, I think the president said, if you have to be treated for COVID, you are going to be covered. However, they've backed off of that and they're like, well, no, not really. So every plan in our system, and we'll look at all those different ways that we finance in a minute, has different policies, different deductibles, different co-payments, etc. So this in part adds to the complexity of our system. Some of it is government run and some of it is private. So here's a chart. It's a little bit old. So essentially, prior to the Affordable Care Act, this is how Americans were being insured with health insurance in the United States. All right, so we see a chart here. You know you're going to be asked this on this exam coming up. What is the largest source of health insurance for Americans? And it's through your employment. Once again, just as we saw in 2008, where a lot of people lost their job, what's going to happen now with this economic downfall, and therefore what is going to happen with employment-based health insurance in this country? Some Americans are able to just go themselves and buy insurance. That was a very complicated and expensive proposition prior to the Affordable Care Act. But now, through the Affordable Care Act, you can go on one of the exchanges or marketplaces and buy insurance yourself. All right, so Medicaid is the purple section, so quite a few people on that. Medicare, and we see that Medicare is growing. Military, the name for the insurance there is TRICARE. And then prior to the Affordable Care Act, we had about 50 million people who were uninsured. And so that 50 million is in part who was being targeted with the Affordable Care Act. And we'll be looking at that later in the course in a little bit more detail. But this is basically how things have how we are insured. And you can see that Medicare is growing, the uninsured was growing, becoming more of a problem, Medicaid was growing. All right, so this is some data that just kind of know these proportions and know that number 50 million. A little bit review of the history that we've seen. This is stuff that we've gone over before. This is a 20th century phenomena, and remember that Blue Cross was that first plan that was coming out of Baylor to cover the teachers. And then those World War II wage freezes are in part were the basis of how we really started adding health insurance or insuring people through the workplace. And then as we discussed, really great health insurance became part of union negotiations in lieu of salary increases. And so this is an important phenomena because people who are insured through their unions tend to have really good coverage. And so if you'll look at some of the debates lately, the unions are very concerned about going to Medicare for all single payer system because they believe that they fought for something that's better than that, and they don't want to give that up. So that's a phenomena that's going on in relation to the election that's currently being discussed right now. So in '65, with President Lyndon Johnson, we saw Medicare and Medicaid. In the next lecture, we're going to talk about those in detail. Kind of the next big thing was the Health Maintenance Organization Act, and I'm going to explain that in a minute. And then there was some backlash about HMOs. So I'll describe that in just a minute here. All right, so the other thing that's going on, health insurance is getting so expensive. And so as it became more and more expensive for companies to include in their packages, instead of paying for it, because they used to just give all employees this and cover it 100%. But they have quit doing that, and the increases in cost, they're passing on to employees. So employees are paying for more of their health care coverage. So here's a list of insurances that that we look at. So government has some programs. As I said, we'll discuss these in more detail in the next lecture. Medicare being one, Medicaid being the other. As we said, military service, which is both the Veterans Administration and TRICARE. And I think I've mentioned this in class before, that Native Americans through the Indian Health Service have their own separate insurance system. So in addition to the government programs, there are the programs that we call indemnity insurance, commercial insurance, traditional insurance, and these are things we usually get through work. So that's what many of us have. Then in addition, as I mentioned, that as healthcare was getting more and more expensive, they were looking for ways to control or manage cost. And health maintenance organizations are one of the ways that they've done that, HMOs. And so the original health maintenance organizations, and you'll see a little bit more about this in the next slide, what they did is they set up these networks or panels of providers. And for you to get any coverage, you had to go in network. So if you went in network, the coverage was pretty good, often 90%, 80%. But if you went out of network, then the coverage was zero. Okay? So they were much more restrictive. I was an executive when all of this was first coming down. And so what would happen is some young people would be in an HMO through their workplace, and that was fine until they went to have a baby. And then this hospital over here, we just had the most wonderful obstetrics package, and so they really wanted to go to that hospital to have this baby, the cutest bags and diapers and films and all this kind of stuff. But there was zero coverage because that hospital was not in the network. That, in part, became the impetus for now what we call managed care. Most often we call these preferred provider organizations, PPOs. And with these, you still get coverage if you go out of network. It's not zero like the restrictive coverage of the HMO, but it's not quite as good. So if you went in network, you got maybe 80% coverage. If you went out of network, maybe the coverage was only 50%, but you still got some coverage. So that's the fundamental difference between HMOs and PPOs. Here's just an example of the flow. So your employer on your behalf gets coverage through your insurance. If you need some insurance, you go to your provider. The provider files a claim with your insurer. The insurer pays the claim. With the HMO, the provider and the insurance are more related. And so the employer kind of contracts with the provider and the insurance, and then the patient accesses the care through there. Now, next it's going to be really important to kind of understand some of the general concepts of insurance. As I said, the number one concept is risk. So you, as an individual, are offloading your risk to the insurance company. They are taking on risk on your behalf. So their goal is to minimize their risk. So insurance is the way that we protect against unpredictable loss. There are many kinds of insurance. You could have homeowners insurance against fires or hurricanes. Car insurance may be one that you're more familiar with. And so the idea is to protect you from accidents. But even with car insurance, remember there's two kinds. One is comprehensive, that covers your vehicle. The state does not care if you are out of money for your vehicle. However, the second aspect of car insurance is liability. What the state does care about is that your vehicle could be a weapon and harm other people. And so you are required by the state to get liability insurance to protect the public. So principles of insurance, that if we're looking at our whole class of 35 people plus me, it's kind of easy to predict what the risk is for a group. The larger the group, the easier it is to predict the risk. However, it's not for a single individual, and that's why individual insurance is so much more expensive than group insurance. And so what they're trying to do is, if we looked at our group, of course you are a group of younger people, but so they have an idea of what the risk would be for 35 people, and so they're going to charge the amount that 34 of you are going to pay a premium and get nothing that year, and all of that premium cost is going to go to cover what might happen to the 35th individual. So that's the way that all of this works. And so they come up with what would be considered the risk pool and actuarially determine the risk for that group. Now, one of the problems with insurance is a concept that we call moral hazard. And that is the tendency of humans to overuse things that they don't have to pay for. All right? It could be cell phones. All right, if you have to pay for every minute that you are talking on your cell phone or texting, you're going to text less. But if you buy a plan that has unlimited use, well, you're just not even going to consider using less bandwidth or using less of a few of your minutes because you have no skin in the game. You have no risk. All right. The other thing that they're concerned about, so that's what the term moral hazard means. The other thing that they're a little bit concerned about is, remember, who can order a test? Well, only the physician. And so the concern was, if physicians can make more money by ordering more tests, then they will order more tests. Okay? So that's kind of the concept of induced demand. So the insurance company wants to put some things in place to protect against their risk from these two things. We talk about several types of insurance. I think we're pretty clear of what group insurance is, and usually you get that at work. In addition, there are some large companies that have a lot of employees, and they're like, you know what, we're going to self-insure. So why should we give profit to an insurance company? We're just going to keep that profit for ourselves because we're large enough that we will be able to estimate what our risk is as well. And so that's what self-insurance. This isn't individuals buying insurance themselves. This is self-insurance through large employers. And hospitals are often one of the large employers. They often contract with some third-party administrator for administrative services only, to process claims, that kind of thing. All right, so large companies do something a little bit different sometimes. And then another group is the individual private health insurance. I had my own consulting firm for about 10 years, and so I was young, healthy, never had anything wrong, and kind of foolishly did not buy insurance for a while. But something came available through one of my trade associations, and then I started purchasing health insurance for myself. Because I was so healthy, I bought one with a very large deductible that we'll talk about in a little bit. But so it wasn't really that much. And so it's like the first 8,000 I had to pay myself. Um, so, but it was, these were kind of expensive. The coverage was not really good. If you had a pre-existing condition, you couldn't buy one of these. They wouldn't insure you. And I'll give you a real quick story. Had some friends. The mom had had breast cancer, had several reoccurrences. Dad started his own company. They wanted to self-insure the family. And so they were afraid that because of her cancer that they would not insure them. However, what they said is, look, man, you're 5 years out from that cancer scare, and so you're okay. We're comfortable with you. However, you have this daughter who went into rehab last year because she's bulimic, and she is risky, and we're not going to insure her. All right, so this is how it went. This was prior to the Affordable Care Act. When the Affordable Care Act was passed, the government said, no, we're not going to let you do this kind of stuff. You've got to insure everybody despite their pre-existing conditions. And so everybody could have access to buying their own insurance through the marketplace. But indeed, then insurance became riskier because it had a larger pool of risky people. So everybody's price did go up. So that was one of the downsides that people complain about with the Affordable Care Act. The people that already had good coverage through their work, their premiums went up. And they're like, well, this is not a good deal for me. I'm paying more for the same thing I had before. All right. So when we look at the Affordable Care Act, we'll look at that in a little bit more detail. But just understanding this insurance and risk and whether you have to be included or we can exclude you is very fundamental in the risk, therefore the pricing of insurance. And then, as I said, it's really managed care. Almost all insurance is some form of managed care. There is a provider network included with almost every insurance product, including the ones that you would get from work. So many of you may be familiar with this, but when you get out in the workplace, you will see that you will have a network of physicians and hospitals that you'll be covered for. All right, so now here are some key terms. And of course, you're going to be expected to know these terms for the exam. And so the person who is insured or the beneficiary is the person who has the insurance. All right. And so they pay a premium. Now, the amount we've been talking about in class of how much premiums cost, I think the average amount we've been using that we'll use for test purposes is $600 a month. And so that's $7,200 a year for the person who has the insurance. However, many people also cover their families. And so you're going to pay more if you are covering more people on your policy. So the premium is the amount that you pay every month. And it's going to be based on who the individual or group is. So if it's a group, it's through work, then they are not going to look at the individuals. If it's an individual, prior to the Affordable Care Act, you had to fill out a really long health profile of, tell us all the times you ever went to a doctor and what they found. And it's like, really, I don't keep track of that stuff. But think of it in terms of car insurance as a good example. So experience rating would be something like for car insurance, there is a group that is a lot more expensive than others, and that is males under the age of 25. Because in general, when they have a wreck, it's not like a little tiny fender bender. It's something really serious. And so the point is, they are seen as riskier and more expensive. So car insurance for males under the age of 25 is a lot more expensive than females under the age of 25. And it's a lot more expensive than older people like me. The community rating, an example of this with car insurance, when I used to live in Dallas and then I moved up here toward Boone, my insurance was cut in half because in Dallas, there were so many freeways, people commuted more, and so there just was a lot more accidents. In addition, in Dallas, there was a lot more car theft. All right. So those are just examples of ways that they use to set the price, the premium. Now here's some trickier stuff to understand. The first is deductibles. So the deductible is the amount that must be paid out of pocket before your insurance kicks in, and it resets every year. So January 1, new insurance year, and everybody has to meet this deductible. Almost every insurance has some form of deductible. So it could be small. Usually have one for inpatient and a different one for outpatient, and you may have another one for drugs. And so maybe it's $200. I'm going to show you a kind, maybe it's $8,000. All right, so you see the difference in those two insurances. And so the deductible resets every year. You must pay that before any insurance is going to pay. The co-payment is an amount that you have to pay once your deductible has been met. And so every time you go to the doctor, you might have a $20 copay, a $40 copay. Every time you get a prescription, same thing. Co-insurance, it may be that the insurance is going to pay 80%, you're going to pay 20%. So you have a hospital service. If you've already met your deductible, and let's say the service was $10,000, your insurance is going to pay $8,000 and you're going to pay $2,000. Okay? So that goes on every time until the last one, the stop loss provision. Most insurance has an amount, and it may be $2,000, it may be $5,000. Once you have paid out of pocket yourself with these deductibles and co-payments or co-insurance, that amount, then for the rest of the year, that the insurance is going to cover you 100%. For most of us, we'll never get to that amount in a year. But my friend that had cancer, she had some insurance through the marketplace. Her stop loss provision was $2,000 between the deductible and the co-payment. With chemotherapy and some of the stuff she was getting, she would get to that maximum out of pocket by the end of January. So for the rest of the year, all of her care was 100% covered. All right, now I put in As You Learn, there's like an example that you can work through that shows how the same care delivered would be applied with different deductibles and co-payments. So work through that and try to understand that. On the exam, you'll be given a real simple example of that, of how to apply co-payments and deductibles. But the reason those are there is this is the cost sharing that the insurance company does to, so you do not have first dollar coverage, and so you would not have that moral hazard of overusing care. So as I said, most of us are going to get this through our employer every year. They negotiate for this. Not only is every insurance company different, Blue Cross, Aetna, Cigna, MetLife, every contract with every employer is different. So your doctor or your hospital has to know what your contract is every time they file a claim on your behalf. Okay, so that's part of what you can look at. That adds the complexity and therefore expense to our system, but it's also job security because they need a lot of people to process all this stuff. All right, and so many families also get coverage. This stuff is getting really, really expensive. I'll show you a slide in a minute. Your insurance may have dental and vision. Usually there's our separate policies. So as a state employee, I can buy dental and vision, but I have to pay separately for it. And then also most plans have prescription drug coverage tied with them too. And there are what they call tiered coverage. So depending on the type of drug, the coverage may be better. And as you know, there's such a thing as generic drugs, and so generic drugs are cheaper than name brand drugs. Now, I want to introduce this concept because many of you will be insured this way once you get off your parents' plans and get into the workplace. A lot of organizations have gone to these high deductible health plans, all right? So your deductible may be $5,000, it may be $8,000, it may be $10,000. And that means that your insurance is not going to kick in until you have met that deductible. All right, so this insurance is going to be a lot cheaper because there's a lot the insurance company isn't going to pay for. But the government has a plan with a health savings account. And so what you can do is your employer may put some money in that, you may put some money in that, and you can use those dollars to pay for that deductible. And so let's say your deductible is $5,000. If you put in $2,000 a year that'll be tax exempt in your health savings account, and you did not have a claim until year 3, because it rolls over every year, then that deductible, you'll have the money to pay for that. All right, so I just want you to understand this exists and kind of what this basic concept is, because this may be what you have. Here's a chart, a little bit old, but just kind of gives you some idea of the relationship between what insurance costs for an employee versus if you cover your family. The numbers that I would change here, if you look at this employee only, this total cost, as we said, is going to be about $600 now. And I think this year, $600 a month. Of that $600, you're going to have to pay, I think it's something like about 40 of it, and the state's going to pay 560 of this premium. Okay? In general, this last far right column, the cost for an employee and their family on average in the United States, we said it's about $7,200 for an individual. But if you cover your whole family, it's about $18,000 a year. Okay? $18,000 a year. So do you see where this cost of insurance has really skyrocketed and is becoming an issue and becoming unaffordable? So that is the number that we'll use on that, for that $7,200 for an individual, and about $18,000 if you have an entire family covered. So this last slide, or this isn't the last one, but what I want you to be aware of is that many employers offer you choices in your insurance. So some of it is like really great insurance, but you're going to pay more for it. Some, the coverage isn't quite as good, but you're not going to pay as much for it. So, for example, I used to always get the 70-30 coverage. I would cover 30%, insurance would cover 70%, because I was a healthy person and nothing happened. And then I got older and stuff happened. I broke my arm. I saw, wow, this is so expensive. So I, as an older person, want more protection. So now I pay more and get the 80-20 plan. This is just, I'm not going to ask you any questions about these numbers on here, but just know, use the numbers that we talked about, and this is increasing. Now, this last slide refers to that Excel spreadsheet example that is also in As You Learn. And so take a look at that, and you can see how this is applied, and that will help you get an understanding about how all this stuff works. All right, so that is it for this lecture, and the second lecture for this week will be on Medicare, Medicaid, and CHIP, and what they're all about. This material will be on this exam that will be online. So I hope this finds you all well, and talk to you soon.